Southern Remedy is underwritten by a grant from the University of Mississippi Medical Center and viewers like you. Thank you.
I was on my way to pick up Jasmine out of carpool. I get a phone call from Jasmine. She said, "Hey, Mom, how far away are you?" I said, "Well, you know, Jazz, I'm in the carpool line, actually." I said, I'm back in carpool line, so it may be about 20 minutes before I can get to the front. I said, "What's wrong? You don't sound good." She said, "I got hit with the ball in basketball practice." And she said, "I'm not feeling so well. I kind of feel like I want to pass out." I said, "Go inside the building and go get Nurse Ellison."
Well, the initial contact that I had was from the secretary. She called in my office and said that a student was on their way up from basketball and that she had already called her mom and told her that she was hit with a basketball and that she was going to come sit in the office and wait for her mom to come pick her up.
We were in basketball practice. It was last block, and we were doing this passing drill where we passed it to each other, and the person ran down the middle, and then at the end they'll do a layup. Well, this one girl, she's so small, so, you know, she got to put a lot of force on the ball to throw, and it just went a little too high, and it hit right here in my temple.
I was the principal at Rosa Scott when Jasmine had the incident that occurred. And I remember getting a call in the afternoon. I'm sure I was dealing with school-related issues, whatever they might have been.
So when that occurred, I came out of my office and then found out who it was. And so from that point, I simply went through a routine. You know, what happened? Can you tell me what happened? Do you remember who you are? So forth like that. She was oriented. She knew who she was. She knew who I was. She knew where she was. There were no indicators to begin with.
As soon as it hit, I just kind of got, you know, off track. My eyes were kind of shaky. And I wasn't pulled from the court, you know. I was just asked, like, was I okay? And honestly, you could tell I wasn't because of the way I was missing my layups. And then when we ran, I was really slow, and I was one of the people who always ran pretty fast on the team.
As time passed, she started slurring her speech. Her posture became slumped over. I would ask her a question, she would repeat the question back to me. So for instance, I would say, "Jasmine, do you know where you are?" "Do I know where I am?" Originally, "Jasmine, do you know where you are?" "Yes, I'm at Rosa Scott." "Do you know what happened to you?" "Yes, basketball hit my head." So I go through the same series of questions to notice if there's any difference in them. And so she was deteriorating. By the time Mom had gotten there, she deteriorated pretty quickly.
I had just got to the front of the school, and I went inside, and she was laying on the floor. We tried to talk with her to see if she would become alert, if she could open her eyes. No response at all.
She didn't know where she was. She didn't even recall what happened to her. She was in and out of consciousness, slumped over. A 15-minute period, she went from knowing where she was to not.
At that moment, Nurse Ellison started checking her vitals. The vitals were still good, but we were not getting a response from her. And at that moment, I told them, I said, "Call an ambulance." I was just told to stand back because they called in the trauma team to work on her, and they couldn't get anything from her. That moment was all in a blur because it was so surreal. It was moving so fast. We were trying to comprehend, like, is this really happening? All she told me was she got hit with the ball. What happened in basketball? The doctors were worried because with her being hit in the head, they didn't see no outward swelling. So they said, usually that's not a good sign because if there's not outward swelling, then there's swelling on the inside. So the whole night they were running tests in and out the whole night, trying to figure out why won't she wake up? Is she really unconscious?
I was scared. I didn't know what was going on. I didn't really remember anything. Of course, when I woke up, I was just staring at the ceiling, and I had a bunch of IVs, and my hair was filled with this type of gel because they ran so many head tests on me, so.
Jasmine stayed unresponsive the rest of the night. She started coming through maybe midday the next day. Every time I think back to the moment, I get real emotional because I think back because she's been hit so many times, had in soccer and different other sports, and just to see her go down like that,
I didn't remember my mom, and I kept asking her who she was because I just couldn't remember her. And even though I tried, they asked me my name. I couldn't remember my name.
A concussion is any injury to the brain that is too mild to cause bleed or bruise on pictures, but significant enough that you have headaches, nausea, vomiting, dizziness, sometimes loss of consciousness, so that we know an insult has occurred, but it's microscopic and not visible.
When we think about mild traumatic brain injury, we really think about symptoms in 4 categories. The physical symptoms like headache, nausea, vomiting, sensitive to light, noises, behavioral problems or irritability, emotional changes, sleep-related symptoms, which are sometimes difficult to see in children.
A hit to the head or body can cause the head and brain to move rapidly back and forth. This sudden movement can cause the brain to bounce around or twist in the skull, creating chemical changes in the brain and sometimes stretching and damaging brain cells.
When you have momentum that stops, or a force that comes in bringing momentum, that structure in this hard substance gets shaken. You can get bruising on the outside. You can have disruption of the vessels inside where it can bleed, or you can have disruption of the little bitty nerve fibers that are pretty delicate inside the brain that get shaken.
The recovery period has been very difficult. She was allowed to go home a week later, but we were set up for speech therapy, occupational therapy, and physical therapy. After those, they sent specialists around in those areas. She was okay with some of the physical, but we had to do occupational and speech because then they discovered she had memory loss. You know, I was determined to get her back. My thing to Nurse Ellison was, as long as we can get back with our academics, if she doesn't do sports again, I'm okay with that.
And so the biggest issue, especially in the growing brain, is for those children that are in school. If they are out of school for injury, they miss crucial learning moments. And so they have to catch up, and sometimes that can potentiate long-term difficulties in school or anxiety about not catching up, and it can play a role on their peers as well, and they may not be able to do the same thing as their peers. Diagnosis of concussion is really based on the mechanism of injury, so how they got injured makes us have to pay attention to the history very closely. And so if there is any concern about a bump, a blow, a jolt, or direct hit to the head, or impulsive trauma to the head or the neck or the torso that may move the head, then we have to be concerned about a concussion if they have had any alteration in their mental status. Sometimes it's a brief glazed look or some dizziness or a brief headache. So we really listen to what happened to them and what symptoms do they have after sustaining that injury.
If you're in a car accident or a motorcycle accident and you have momentum that suddenly stops, it's a little more likely to have more recurrent forces, and you have the lighter structures on the outside of the brain that are less dense. And then you have the brainstem that comes up to the center structures that are very, very dense. And so that makes a difference in how it moves inside the skull, and so they can move in opposite directions and tear all the little connecting nerves that help us coordinate thought and consciousness. And when that happens to a significant degree, you can have a coma. When it happens to a milder degree, it's a concussion.
We really don't know the long-term effects of mild traumatic brain injury in the younger child. So we're just beginning to learn about it as adults from the NFL. They've really brought to light a lot of long-term concerns that we should be paying attention to earlier. So we really don't know as much about the developing brain and traumatic brain injury.
Barnes got 5 to choose from, got hit, got thrown down. and is shaken up.
My last play as an NFL player was probably the worst concussion I ever had. You know, I remember walking off as I like to say, as the fog cleared, if that's a good example. As I walked off the field and started kind of getting my bearings straight, I thought to myself, I don't know if there's ever a good time for a concussion, but at 41, that's probably, if there was ever writing on the wall, this is it, I'm done. My dad and coaches like him in that era or before thrived off of pain, hurt, fatigue. You know, I always joke with people and say my dad, water was a dirty word. You didn't ever say, Dad or Coach, I need water. That insinuated that you were soft. Just like, you know, I just got dinged in the head. Well, you're gonna have worse than a ding in the head. I mean, that's, and I'm being nice. But I think you have to go back and I think about this, you would be dealing with, unless you educate and almost prove to my dad or that generation that this is a big problem.
I played football, started playing in second grade, played through high school and through college, and fortunate enough to be inducted into the Mississippi Sports Hall of Fame and the National College Football Hall of Fame. I've been around sports and that sport for a long time. My father played 10 years in the NFL after leaving Ole Miss in the late 50s. I think maybe I had a concussion or two. I'm not sure if I can point to a time that I know that I did. I know I had a lot of collisions over a number of years, and then I think I was blessed and fortunate to not have issues or times that I can remember of like losing a sense of where I was or anything like that. So could I have had some minors? Maybe. For the most part, I think I was okay. He played for the Cleveland Browns for 7 years, played for the New Orleans Saints for 3 years. He was a tight end when he first went into the pros with the Browns, and they won a world championship in 1964. And the next year, he actually moved to the defensive side of the ball and moved to an outside linebacker position. Made All-Pro that next year on the defensive side, and then finished out his career as an outside linebacker and some defensive end. I did see my dad decline, you know, later in life when he was diagnosed with ALS, and having that history in the NFL and how that went down in a hurry for him. And I know that he talked about having a number of concussions performing at that level.
You know, you didn't think about coming out because that was, you know, you'd be considered a wimp, you know, or whatever, you know. And so my last 5 years is when the last play I came out, and that was my last play ever. I had a concussion several years before that where I actually blacked out for a period of time. You know, and I get this question all the time. How many concussions have you had? And I sort of jokingly say, I don't remember. But in all honesty, I don't know, because what we know now is you don't have to be knocked out cold for a concussion. And that's what's scary. If you said, how many times did I see stars? Every time I got tackled. And if that's a concussion, it's pretty frightening.
Concussions are most common in students playing sports. According to the CDC, 2.5 million high school students reported having at least one sports-related concussion. Students who play more than one sport are at a higher risk for this brain injury.
Brett Favre returned to his native Mississippi right after his retirement back in 2010 for life on the sidelines.
And since then, he's been busy coaching a team near his home, trying to win a high school state championship.
We had a wonderful, great head coach, Neville Barr, who was smart. He was old school, but he had graduated to the new way of thinking. And he was tough, but he was smart. And I think that's, you know, in the world we're in right now, in the football world, with what we have at our fingertips, that's the best approach. Tough, but smart about it. I don't have to make these guys tackle each other day in and day out. They're going to do that in a game. I want to teach them the fundamentals. You can do things in a walk-through manner, but at times you have to be a little bit physical because it is a physical game. That's really how I kind of looked at it. I thought he did a wonderful job of handling the kids from a physical and a mental standpoint. There's a time to chew them out. There's a time to put your arm around them. And I learned from my dad, there's a time to chew them out, and then there's a time to chew them out. And you never put your arm around them. And I learned that part, but you have to put your arm around them and tell them, you know, they did well and be positive influences in their life as well.
My favorite sports was first, it was soccer. And I started basketball like a year after, which I was around like 5 years old, so around 6, I started basketball. And my favorite sport to watch is soccer, even though people think it's boring, but it's really fun. I like it. When you're on a team, you kind of just have that motive to always want to finish out. And I guess you could say, with me being very competitive, I don't like to back down.
I mean, your brain, you have to consider it's like an egg. And the outer part of that egg needs to be protected because that inner part is the main organ for everything else in your body. And if that brain does not mature properly, develop properly, or has any injury to it, then it can mess up all the rest of you. Educationally, how you function. It's important for people to know that also that concussion is not a structural injury, it's a functional injury. X-rays don't pick up a concussion.
I would say it's a new normal because what was so important to her at one time has now, I won't say become less important. For her to see things the way I see things, as far as doing well in school, that's new.
Well, it's been hard because I have to remind myself I can't do everything that I used to be able to do. I couldn't push myself like I wanted to. So even if I did do a sport, it wasn't always like easy to just, you know, do what I used to do.
Her personality, the attitude, I think all that is new. A lot of the treatment was rest the brain, meaning, hey, no stress, feel headaches coming on, let's rest. And I think a lot of that comes, so the new normal, I think, comes from a lot of the treatment that we had.
I feel lost as a person because I'm not used to just, you know, not being on the court, being on the field, being able to just do what I used to do. I'm not used to that. I'm not used to taking anything easy, so I get emotional.
We have dealt with depression. We've dealt with breakdowns, frustration rather. We've dealt with stress. It's been a lot for us to handle during this recovery time.